Let's go live now to Dr. Stephen Judd, who's been the CEO of aged care charity HammondCare for more than 20 years. Dr. Judd, thanks so much for your time. Give us a sense of how your organisation is managing this balance, this difficult balance between maintaining some engagement between your residents with their loved ones, but also protecting them.
Thanks, Kieran. Look, I don't think anyone should be having a crack at any provider about what they're doing. These are difficult decisions, and different environments demand different responses. I mean, we haven't locked down, quote unquote, our residential care services. And I have to say the term lockdown is a bit misleading. There are still staff entering services, laundry people, services personnel, medical, and so on. So when someone talks about a service being locked down, it means that relatives and friends are not visiting. Now, we actually went out and asked residents and their representatives as to what we should do. And there was a huge response to the survey. 86% of the respondents said they wanted personal visiting to continue. And when we asked them about, sort of increased risk, they still, two-thirds, 2 out of every 3 said that even with the choice of increased risk, they still wanted personal visiting to occur. And now that's not to say that there's not other forms of visiting and making contact. There's WhatsApp, there's Skype, there's the actual telephone. There's mail. We've got people sending in something special. Kids can't visit at the moment from school groups, but they're actually coming along, they're sending along various cards and things. So my comment is that physical well-being has to be balanced with emotional and social and social well-being and mental well-being at all. And in an attempt to balance or attempt to eliminate one risk, we actually have the danger of introducing other risks such as loneliness and mental health needs.
Absolutely. And in terms of some of the protections you're putting in place, you've enabled staff and volunteers to have a visitor concierge. Is that the best way to describe it in terms of trying to screen for any conditions and so on?
That's right. It's not a free-for-all. I mean, there is one visitor for an hour each day, and there's restricted visiting hours as opposed to any time, and we are avoiding visits during busier times, and visiting occurs in a resident's own room or in the outdoors. And when they do visit, there is social distancing, of course. And, of course, there's special exceptions if there's end-of-life palliative care. And, when people come along to our homes, there's a concierge at the front door. They do a system assessment. They ask about travel. They ask any contact and so on, the temperature testing. And that's not just for visitors only. That's for all staff, care staff, laundry staff, whoever. We have what we call a toolbox kit, toolbox talk, which is a little bit of a quiz about what is coronavirus, how can we avoid its spread, what are the symptoms, what are the things we can do to restrict it. And that concierge role, I have to say it's been great how staff and members of the community have stepped up to help us there. And that concierge role, we had about 140, 150 people over the Easter weekend doing that. And it actually meant that the care staff can get on with what they're doing without actually having to worry about screening people. And so it means we've redeployed staff from office jobs into that role, as well as actually getting people from the community to help us.
And with the federal government guidelines, just finally, how does the organisation work within that frame to ensure that you're well within what the federal government's suggesting in terms of the number of visitors per resident? Well,
the federal guidelines, which are reflected in various orders in various states, says 2 visitors per person. We actually have chosen to have 1. It's because we've got smaller environments, small cottages. So if you actually had 2 visitors in our services, it would be quite challenging. So we have 1 rather than 2. So we are compliant with what the federal government and the state gazettes and directions are. But we are compliant with them, but we've actually sort of tailored it to our own specific small services.
Dr. Stephen Judd, CEO of aged care charity HammondCare, I appreciate your time on a challenging period for you and your organisation as you manage this. Thanks so much for that.
Thanks, Kieran.